The National Health Service in the United Kingdom extends a warm welcome to international nurses. We value the diverse skills and experiences you bring to our healthcare system. Joining the NHS is an exciting opportunity to work in a world-renowned healthcare system. You'll collaborate with skilled colleagues, provide exceptional patient care, and contribute to high-quality healthcare for all. This guide will equip you with the knowledge and tools to approach your NHS interview with confidence. Preparation is crucial for a successful NHS interview. By investing time in understanding the process and practicing your responses, you'll increase your chances of securing your desired nursing role. This guide provides a step-by-step roadmap to ensure you're well prepared for each stage of the interview. We'll delve into the specific types of questions you can expect, such as behavioural, scenario-based, and technical questions. Additionally, we'll provide tips on researching the NHS trust you're applying to and familiarising yourself with the UK healthcare system. Thorough preparation is the key to unlocking your NHS career aspirations. The NHS interview is a crucial step in your journey to becoming an NHS nurse. It's an opportunity for the panel to assess your skills, experience, and suitability for the role. The interview is typically conducted by a panel of 2 to 3 experienced healthcare professionals. The setting is generally professional yet welcoming, aiming to create a comfortable environment for you. Remember to take deep breaths, speak clearly, and maintain a positive and professional demeanour throughout the interview. The primary purpose of the NHS interview is to evaluate your suitability for the nursing role and the NHS work environment. The panel will assess your clinical knowledge, communication skills, problem-solving abilities, and alignment with the NHS's core values. They want to understand how your skills and experience align with the role and how you would handle real-life clinical situations. They will also look for evidence of your commitment to lifelong learning and your ability to work effectively as part of a multidisciplinary team. Navigating the interview waters. Types of questions. To prepare effectively for your NHS interview, it's essential to understand the different types of questions you may encounter. The interview will typically include a mix of behavioural, scenario-based, and technical questions. Behavioural questions explore your past experiences to assess how you handled specific situations. Scenario-based questions present you with hypothetical clinical situations to assess your judgment and decision-making skills. Examples include, what would you do if a patient refused treatment? Or, how would you handle a situation where you suspected a colleague of making a medication error? Understanding these question types will help you craft well-structured and compelling answers. Showcasing your skills, the STAR method. Technical questions evaluate your clinical knowledge and understanding of nursing procedures. To answer behavioural and scenario-based questions effectively, use the STAR method: situation, task, action, result. This structured approach helps you provide clear and concise answers that showcase your skills and experience. Begin by describing the situation or task you faced, then outline the action you took, and finally, explain the result of your actions. Using specific examples from your nursing experience will make your answers more impactful. Research and preparation. Your keys to success. Thorough preparation is the cornerstone of a successful NHS interview. Start by revisiting the job description and person specification for the nursing role you've applied for. Carefully analyse the essential and desirable criteria outlined in the documents. This analysis will help you tailor your responses to align with the specific requirements of the role. Next, delve into researching the NHS trust you're interviewing with. Familiarise yourself with their services, specialities, values, and patient demographics. Understanding the NHS and its values. The NHS holds a unique place in British society, and understanding its core values is paramount for any aspiring NHS nurse. The NHS is founded on the principles of providing high-quality, comprehensive healthcare to all, free at the point of delivery. Familiarise yourself with the NHS Constitution, which outlines the rights and responsibilities of patients and staff. Reflect on how your own values and nursing philosophy align with these principles, and be prepared to discuss them during the interview. Mastering the STAR method for effective responses. The STAR method is an invaluable tool for structuring your responses to behavioural and scenario-based questions. This method helps you provide clear, concise, and impactful answers that showcase your skills and experience. Let's break down the STAR method further. Situation. Begin by setting the scene and providing context for your example. Task. Outline the specific task or challenge you were responsible for addressing. Action. Describe the specific actions you took to address the situation or task. Use action verbs to make your response more dynamic and engaging. Result. Finally, describe the outcome of your actions. By following the STAR method, you'll provide structured, evidence-based responses that demonstrate your capabilities. Practice makes perfect mock interviews and refinement. Practice is essential for interview success.
Gather a friend, family member, or mentor to conduct mock interviews with you, focusing on common NHS interview questions. This practice will help you refine your responses, improve your pacing and clarity, and build your confidence.
Record your mock interviews if possible, so you can review your body language, tone of voice, and identify areas for improvement. Seek feedback from your mock interviewer on your responses, focusing on the clarity of your examples and the overall impact of your answers. Arriving prepared. Setting the stage for success. The day of your NHS interview has arrived, and it's natural to feel a mix of excitement and nerves. Before you head off to the interview, double-check that you have all the necessary documents, a copy of your CV, your professional registration documents, and any other requested materials. Plan your journey to the interview location in advance, allowing ample time for travel and potential delays. Aim to arrive 10 to 15 minutes early to allow time to compose yourself and complete any necessary paperwork. Take a moment to relax and gather your thoughts. Remember to silence your mobile phone to avoid distractions during the interview. Making a positive first impression. The introduction. The interview will typically commence with introductions. The panel members will introduce themselves, their roles, and provide a brief overview of the interview process. Use this opportunity to make a positive first impression. Greet the panel members with a firm handshake, if culturally appropriate, maintain eye contact, and smile warmly. Speak clearly and confidently when introducing yourself. Listen attentively to their explanations and don't hesitate to ask clarifying questions if needed. Showcasing your abilities. Behavioural and scenario-based questions. Following the introductions, the interview will typically transition into behavioural and scenario-based questions. These questions are designed to assess your skills, experience, and how you've handled specific situations in the past. The panel wants to understand your thought processes and decision-making abilities. As you answer these questions, remember the STAR method: situation, task, action, result. Use specific examples from your nursing experience to illustrate your points and demonstrate your capabilities to the panel. Demonstrating your clinical acumen, technical questions, and communication assessment. Be prepared to answer technical questions related to your nursing knowledge and experience. These questions may cover topics specific to the role you're applying for, such as medication administration, wound care, or patient assessment. The panel will assess your understanding of essential nursing principles and your commitment to patient safety. When answering technical questions, be clear, concise, and accurate in your responses. If you're unsure about a particular detail, express your willingness to learn and seek guidance from senior colleagues. Clear communication, the cornerstone of patient-centered care. Effective communication is paramount in nursing. It forms the bedrock of trust between healthcare professionals and patients. For international nurses joining the NHS, clear communication is crucial, as you'll be interacting with patients from diverse backgrounds. The NHS is committed to providing patient-centered care, where patients' individual needs, preferences, and values are at the heart of everything we do. As an international nurse, your ability to communicate clearly and empathetically with patients is highly valued within the NHS. Navigating language barriers with sensitivity and skill. While English is the official language of the UK, some patients may have limited English proficiency. The NHS provides access to professional interpreters and translation services to facilitate communication. Familiarize yourself with the Trust's policies for accessing these services. When using an interpreter, speak directly to the patient, maintaining eye contact and a respectful demeanour. During your NHS interview, the panel may assess your communication skills through various methods. They may ask you to explain medical terms or procedures in plain language, as if you were speaking to a patient with no medical background. They may also present you with hypothetical scenarios involving patient interactions, demonstrate empathy, active listening skills, and the ability to tailor your communication style to the individual needs of the patient. Provide examples from your nursing experience where you've successfully communicated with patients from diverse backgrounds. After completing your NHS interview, it's natural to eagerly await the outcome. The interview panel will carefully consider your performance, reviewing your responses to each question and evaluating your suitability for the role based on the job description, person specification, and the NHS's core values. They will assess your clinical knowledge, communication skills, problem-solving abilities, teamwork skills, and your alignment with the NHS's commitment to patient-centered care. The decision-making process may take some time, as the panel may need to interview other candidates or consult with colleagues to gather further information. Rest assured that the NHS is committed to a fair and transparent recruitment process, and you'll be notified of the outcome as soon as a decision has been made. Seeking feedback is a valuable opportunity for growth. If you're offered the nursing role, congratulations. Your hard work and preparation have paid off. You'll receive a formal job offer outlining the terms and conditions of your employment, including your salary, working hours, and start date. If you're not selected for the role, don't be disheartened. View it as a learning opportunity and a chance to grow. Request feedback from the interview panel to gain valuable insights into your performance. Ask specific questions about areas where you excelled and areas where you could improve. Understanding their perspective can help you identify your strengths and weaknesses, allowing you to focus your preparation for future interviews. Remember that every interview is a learning experience, bringing you one step closer to achieving your goal of joining the NHS. Embracing your NHS journey is a rewarding career that awaits you. Navigating the NHS interview process as an international nurse is a significant step towards a fulfilling and rewarding career in the United Kingdom. By understanding the interview structure, preparing thoroughly, and approaching the process with confidence and authenticity, you can significantly increase your chances of success. Remember that the NHS values the diverse skills and experiences that international nurses bring to the healthcare system. Your commitment to providing compassionate, patient-centered care is highly regarded, and your contributions will be invaluable to the NHS and the patients you serve. Throughout this guide, we've explored the essential steps to prepare for your NHS interview, from understanding the NHS's core values and mastering the STAR method, to navigating language barriers and seeking feedback for growth. Embrace the opportunity to showcase your skills, experience, and passion for nursing. The NHS offers a supportive and enriching work environment where you can develop your career, collaborate with skilled colleagues, and make a real difference in the lives of patients. Be yourself. Authenticity is key. Let your passion for nursing and your desire to contribute to the NHS shine through. Highlight your cultural awareness and experiences with diverse patients. Demonstrate adaptability and willingness to learn. Ask thoughtful questions to show engagement and curiosity. Approach the interview with confidence and enthusiasm. You'll be on your way to a rewarding career as an NHS nurse. A final word of encouragement. Stepping into your NHS interview, remember your journey is admirable. You bring unique skills and perspectives that enrich the NHS. Your passion shines brighter than any interview nerves. Believe in yourself and your abilities. Approach the interview with authenticity and enthusiasm. Your NHS journey awaits. Best of luck. If you found this video helpful, please like, share and subscribe to the GK Health Passport channel for more videos.